Welcome everyone to Innocast. I'm Jonathan Fritz, the Chief Innovation Officer at Chime. For those viewing live, we're excited to have you join us today. And those viewing on demand, welcome. Special thank you to our leading supporters, ClearSense and Medtronic. So let's start with why. Why do we launch this program? Quite frankly, most hospitals aren't set up to engage with nimble startup companies, and most startups don't know how to partner with hospitals. COVID-19 has changed the game. Now hospital executives see what is possible and how quickly and effectively problems can be solved when you remove roadblocks. We want to remove the roadblocks for solutions positively impacting health and care globally. As a startup investor and recovering patent and venture capital attorney, I'm keenly aware of this problem. Simply put, we want to highlight innovation between health systems and startups. This program is all about real problems faced by hospital leaders and how they solve them in partnership with emerging technology companies. Today, we're focusing on the partnership between Cook Children's and PatientEXP. Thank you to our speakers, Teresa Meadows, SVP and CIO of Cook Children's Healthcare System, and Archie Cobbs, founder and CEO of PatientEXP, who will be talking about deploying a communication platform for healthcare. Time permitting, we'll take a couple of questions at the end, so please submit any questions in the Q&A tab. As a reminder, we have an exclusive Q&A session for Chime provider members only. You're welcome to join the special behind-the-scenes session immediately following this webinar. At the end, please exit this webinar and join the separate Zoom meeting. If you don't have that link, please send Christy Kenyon a message. Also, this session is being recorded and will be available on demand viewing. Teresa and Archie, please take it away.
Wonderful. Good morning. Thanks, everybody. I'm going to share my screen really quickly here, and we'll get this started. All right, good morning. We're going to talk this morning about how we built and deployed a communication platform for healthcare through a partnership that Cook Children's had with PatientEXP. We get a lot of questions about, how did you actually start, get connected with a startup, and how did you get the buy-in for innovation? And really, when you're thinking about doing some kind of joint venture or a startup relationship, you really have to think about what the problem is. And every opportunity that I've had to co-develop a product with a startup, we really started with, okay, we have this issue. And when we looked at the market, there's really not any technology on the market that would fit the need that we're trying, or the problem that we're trying to solve. And then we kind of start working on a solution, and we hope that the solution that we develop will also give us key insights that can make this into something that larger entities, larger problems can be solved with. You really don't want to create something that's going to solve your one problem and that's it, unless it's something that's a big, hairy problem. You really try to look for something that can be multi-purpose and solve multitude of issues. And, like sometimes when you start the work, you look back and you say, wow, that was super obvious. We should have thought about that early on in the process. And as we go through, we learn more things. I had the privilege in my previous role, I worked for Ascension Health, and we had actually worked with a company called AwareX, and we were their development partner. And we produced a product that actually eventually was sold to McKesson called Horizon Enterprise Visibility. And so sometimes when you're looking for an innovative partner, you go back to someone that you've worked with in the past. And so that's the relationship that Archie and I had when I came to Cook Children's. Is Archie had been part of the AwareX development process, and I knew that Archie and team had a skill set for innovation. And so sometimes you are lucky enough to have worked with someone before who has great insight to innovation. And then sometimes you have to go out and search for people who can kind of work with you and meet your needs. So what was our problem? We were about 8 years ago, 7 years ago, we were really trying to improve the patient experience. And if you think about a children's hospital, we're really dealing with the millennial population. And so what we kept hearing from our patients and family members and moms and dads was, we don't, it's really hard to get communication about what we're doing from the healthcare organization. And ideally, we would like to have the communication through texting or some other mobile mechanism. And we did not have a good avenue then to really, um, begin to build a product. We looked at the market, there was nothing on the market. And so I reached out to Archie and team, and they were kind of thinking around the same lines that we were, is how do we improve communication with the patients in a healthcare system, and where it's consistent and it's something that happens on a regular basis. The problem that we worked on was we had disjointed, siloed communication. We had inconsistent ways that people were communicating with patients. It might be through phone calling, it could be an email, it could be, any number of ways. It was really inflexible. So, if I were coming in for a radiology procedure, depending on the person who called me or the person who interacted with me, the communication could be different. There certainly was no branding or any kind of control about what the message was. And so the idea that we had is that we needed an enterprise-wide healthcare communication platform that would allow us to have consistent, reliable communication, utilize the existing, you know, education, communication channels that we had, and also maximize our investment in technology that we already had through our electronic medical record and some of our other systems. And we hoped that we could use transactions that occurred in those systems to drive communication. So what do you do? Do you build a custom app, or do you just use texting? These were all the questions that Archie and I started to ask ourselves. How do we break down the barriers of texting? How do we get people to sign up? How do we have people opt in or opt out to our texting vision? And what about PHI? We wanted to make sure that we were HIPAA compliant and we weren't doing anything that could potentially be seen as a HIPAA violation. And with texting, you have a very limited number of characters that you can use. And so we tried to keep things very simple throughout the process, and talk about how do we make the best use of the communication tools that we have.
Okay, so this was a new thing we were trying to do, and it wasn't really clear at first exactly what it would be, but the design criteria kind of derived from thinking about how it ought to work. So, first of all, this was going to be we wanted it to be a nexus for communication. So there could be several systems, and there are in fact several systems that are going to be channeling communication through this or triggering communication of some kind. So the integration was a big part of that in terms of being capable of, receiving HL7 for kind of real-time data flow, but also other systems may need to, upload a flat file that we import or use a REST API. So integration was a key component. Another key component was that we were with text messaging, we wanted to make sure that we were sending valuable communications and not being annoying to people. And so, in other words, you have to communicate intelligently. And to do that, you really have to be what we call stateful, which means the system can't just be triggering off of events from some third-party system and then forgetting. It has to remember what it's done in the past, and it has to keep track of its own information. So, for example, if you send somebody maps and directions, here's a link to Google Maps to get to the clinic that you have an appointment for. Well, that's really handy the first time, but if you have an appointment at that same clinic a week later, you probably remember how to get there, so you don't need that again. So the system needs to have some of those subtle rules and logic embedded in it, and to be able to do that, it needed its own database internally. So text, voice, and email were the the media that we wanted to communicate with. In practice, almost everything's done via text because it's just so convenient. But we do support voice and email. And then we wanted to give patients a care circle that where that, you know, it should be interactive. They can kind of manage who they get communicated with. So, you know, for Children's Hospital, you know, both parents may want to receive the messages. And so that if there's only one phone number in the patient field, then you could only have one person. But this way we allow people to manage that. So yeah, as we started thinking about this, I mean, one initial worry, you know, this was several years ago when we started, and at the time, text messaging wasn't as widely used by, you know, businesses and enterprises. You know, airlines were doing it, I guess, but not a lot of other people. And, you know, we were worried that the text messaging channel, it's so convenient that it would be easy to overdo it. And we thought about, you know, how can we make sure that we're not overdoing it? And the more you think about that, the more you realize that's not really a function of the channel that you're communicating over. It's a function of the message that you're delivering. And if that message is high value, you know, timely and relevant and intelligent, then people will see that as a trusted communication channel. They'll pay attention, they'll like it, and they'll want to interact with it. So our goal was to stay away from the left side of this spectrum and stay on the right side. And you can see I kind of marked a few places along there that, you know, like the website is great, lots of information, but it's a passive thing. It doesn't jump out and tell you something you need to know in the moment you need to know it. You have to go find it yourself. So we wanted to be, you know, as much as possible, timely and relevant. So where are we at today? So in 2020, we sent 10 million text messages. And to be clear, that's a 140 byte SMS chunk. So, you know, some messages are maybe 2 of those or 3 of those sometimes, but that's an incredible number. And it just shows how this thing has grown from where we started at Cook. You know, we started with just the kind of appointment related things, but we've all kinds of new ideas have been added on, and I'll show some of those in a minute. To me, the most important statistic here is the last one, which is that the opt-out ratio. So that's the number of people who've gotten messages and replied stop because they don't want that. So that to me is confirmation that we've been able to stay on the right side of that spectrum, where we're sending people a lot of information, but they're finding it useful and they're interacting with it. And very few are saying, hey, no, I don't want this. So that's that was a very a good number to see once we got this thing up and running.
Yeah, Archie, I might add here. So if you look at the graph on the right, so 69% of our families actually interact with the message that they're sent. So typically when we send a message, there's a link in that message. So it might be a link to the prep instructions. It might be a link to directions. It might be a link to some other bit of information. So almost 70% of the patients actually interact and go and use those links, where 30% we know got the text message, but maybe didn't interact as much. And then that little small red section is really that opt-out ratio where the 1% basically said, I don't want to get your text at all. So, you know, to have 70% of people who are actually using and interacting with your texting and your instructions is really a good measure of how successful this platform actually is. Especially when we're sending 10 million texts a year, you could easily be seen as something that is definitely spam.
Yeah, so it's the top number and the bottom number is a great combination. So, you know, we started with what we now call the appointment experience, because really it is its own kind of thing. It's not just reminders, you know, prep instructions, pre-register maps. some customers have kind of awkward parking situations, so they send a link to a video where you can see kind of step by step how to park and what elevator to get on and everything. When people show up and register, in some cases we'll send a welcome message. You might get a map to the facility showing where Chick-fil-A is, or Build-A-Bear coupons, things like that. And then after the experience or the appointment, link to the portal for follow-up. But there's a whole lot of other stuff. A lot of times we'll deploy this for one reason. A customer may want to solve a no-show problem, but then once it's installed, the wheels start turning, and people realize, oh, there's all these other things we could do, and it's designed to be general purpose like that. So some of these are kind of interesting. So surveys are a good example where it's a good example of the principle that you don't have to do everything, but you can link to everything. So, in theory, you could do a survey through text messaging, but it's much simpler. We just link to SurveyMonkey or wherever, and SurveyMonkey has a perfectly good system for tracking surveys. But you send that the day after the appointment, right when it's fresh in somebody's mind, and they're, it's so easy to do that we get a good response rate on that. Another just random one is the when you check in at a restaurant, they give you a little coaster or a little pager thing. That we have a similar thing at some of the cook facilities where someone can check in and then they get signed up on this kind of pager list, and then they can roam around the facility, and then they'll get a text message when it's time to come back and get seen. And there are a bunch of other use cases, as you can see.
And the beauty of all of this is that it really is hands-off communication. So it's driven by normal workflows that would occur in your institution. So the appointment experience, the way that works is I call or I book an online appointment. That when I book that online appointment, it then kicks off a series of these text messages based on a rule set. So it knows, X number of days before the radiology procedure, I'm going to send the prep instructions, and it's all predefined texting. So you're not worried about people who might, misspell words or, maybe not communicate the way you would like it to. So the best part of this is it works off what our clinicians and office staff would be doing just in their normal activities. It doesn't require extra activities for them to, for us to communicate with the patient.
Yeah, that's a great point. And that was actually one of the design criteria I forgot to mention, that namely that it should be as automated as possible, because, we don't want to add to the burden of staff. Okay, so over time, like as happens with these things, you get some key insights, and then they sort of seem obvious in retrospect, but you could never have necessarily arrived at them without going through the process. First one is that communication with patients is a really essential function in healthcare. Traditionally it's been done kind of in an ad hoc way, but it really does benefit from having kind of a first-class solution or a system that's dedicated to doing that. The second insight was less obvious, and which is that if you stay on the right side of that spectrum, where you've built a trusted communication channel, then you have a really powerful tool for affecting people's behavior and helping people to get what they need. And you saw the list of tactical use cases. There's lots of those, but less obvious is that you can address strategic use cases sometimes that may not have had another way to easily address. So we'll talk about a couple of those real quick, and I'll let Teresa talk about the first one.
All right. So we had a couple of challenges that we were working towards. One was we had recently built several urgent cares. So at our Cook Children's ED, we actually see in the wintertime about 700 patients a day in our emergency department. And many of those patients really could have been seen either by their primary care physician or in an urgent care scenario. And so we still had lots and lots of people who would come to the ED. And we were trying to figure out what's the best way to get them to the most efficient place of care. The urgent care was much closer. It was brand new and opened. And if we can get patients to go to the UCC and really only see the patients in the ED that need to be seen in the ED, everybody wins. But how do we do that? And so we built a process where um, we tracked all the patients who were coming to our ED. And then we looked at their level of care. So if the patient who came to the ED was a level 4 or a level 5, which basically meant they were low severity and they could have gone to an urgent care or primary care, we actually targeted them by zip code, and using Google Maps, we actually sent them a really polite message that said, "Thank you so much for coming to our ED. Did you know we have an urgent care that is right by your home, and here are the areas here are the hours and when they're open. Just wanted to let you know that." And then what we did is in the tool, we had a control group and a group that we sent these texts to. And what we found was that with that randomized control, 29% of the people who actually received "please go to our UCC the next time" actually went. And so that was something that we felt like, okay, our communication strategy worked. We saw a change in behavior, and we were able to kind of measure is what we're communicating the right message, because we really wanted to drive volume to those UCCs. And the beauty of the tool is that it knows that Teresa lives in a certain zip code. It knows that our clinic is in a certain zip code, and we can pair those things together and send the appropriate link and message to that patient for the next time. And so we felt like that was a scenario that we tested that actually worked. And so now we do that to ensure that people know that they have other alternatives other than just coming to our ED for patient care.
Yeah, and I'd say that's a great example of, you're not forcing people to do something. You're giving them information that's they want to receive and that's valuable. I mean, who wouldn't rather, go somewhere near their house than sit 4 hours in the emergency room? All right, the second challenge, has been a challenge for the whole world, is COVID. In March, basically Cook canceled everything, or as did the whole world. Everybody was kind of hunkering down. But it quickly became clear that, we've got all these clinics and they all have waiting rooms, and you're going to bring a bunch of people together in there. That's probably not a good idea. So how are we going to adapt to that? So this was a good example of, having a really good relationship between the two development partners here, because we were able to kind of prototype something, test it out on a couple of clinics, get some feedback, make some tweaks and adjustments, and then roll this out pretty quickly over a matter of 6 weeks or so. And basically the solution we came up with is a pretty simple one. You text people, before the appointment what's going to happen, and tell them that when they arrive, just stay in the car, text here. And then that puts them on a list that the staff can see in the UI and see how long people have been waiting. And then when they're ready to see someone, they right click, and that sends a text message to tell them to come in. So on the next slide, it shows kind of the workflow. Pretty straightforward, pretty easy to handle.
Archie, I might just add, just to give you some perspective of what the volume that is, we have 80 plus clinics, specialty and primary care, and our urgent cares. And so we were literally able to roll this out in a very short period of time. which was extremely helpful. And that's the value of being in a partnership where you're working with a startup company. The agility is highly critical, especially when you're trying to, you know, do something in a short period of time.
Yeah, definitely. All right, so we're running low on time, so I'll try to. We only got a couple more slides. This is just a quick look at the staff UI for this. So this is a good example of a combination of automated communication, but also manual interaction. So the staff sees this and then they right click on patients when they're ready to tell them to come in. Finally, some lessons learned from this project. I think we've talked about a lot of these, but the bottom line, communication is important. If you communicate intelligently, it takes work to do that, but it's a worthwhile endeavor because then you have a really powerful tool.
Yeah, and I think over the years we've learned lots of valuable lessons too. Just making sure that text can be valuable if you do it intelligently. So not everything is text worthy. So having a governance process that we've put in place about what we'll text, what we won't, making sure that the channel that you're using is trusted, because if once it becomes something that feels like spam, then people don't pay attention to it. And we've done a really good job over the years, as you can see from our opt-out rate, ensuring that we don't turn this into something that's not useful. And then, there's thousands of other uses that you can do over the years. And you see on the slides before that we developed lots of use cases. And then lastly, quickly, I'll just say, what makes it work? Leadership commitment at your organization. When you go into a development partnership, it's really important that you have buy-in from the very top, because not all innovations work. And so you go into it sometimes with a little bit of risk, and being able to work through those issues is truly important. Having those rapid test cycles so you can test something out and see if it works, and then improve it if it doesn't. And then definitely, the most important part is your healthcare system gets a solution that meets their needs, but also a startup company gets a first committed customer that allows them to go out and sell the new product. And then everybody learns. And so I think that's the value in innovation and working with startup companies.
Teresa and Archie, thank you very much. Really appreciate your time today. For all the Chime members, just wanted to let you know that we've got an exclusive Q&A session starting up here in a minute. Next week, we have another Innocast presentation, 11 a.m. Eastern, a week from today, with Jeff Sturman, the SVP and CIO of Memorial Healthcare System, and Seth Friedman, the CEO of Intelligent Observation, to hear how they're implementing hand hygiene monitoring system. So if you're a Chime member, please navigate from this Zoom webinar. So leave this webinar and then start the Zoom meeting that you would have received a separate link for. And we'll have that exclusive behind the scenes Q&A session. But thank you everyone for joining us today. As a reminder, this session was recorded and will be available again soon. We will also be sending out a brief survey following the presentation, and would love your input and any recommendations for future topics. Thank you again, and we hope to see you at our Innocast session next week.